Hello, welcome to Chapter 6, Infection Control Fundamentals. Please take a moment to review the learning outcomes listed below. In Learning Outcome 6.1, we will identify OSHA's role in protecting healthcare workers. OSHA is an act and a federal agency existing within the Department of Labor. There are also 50 state OSHA agencies supporting the federal administration. Healthcare workers face safety challenges that the Act of 1970 was created to address. The CDC works closely with OSHA to prevent unsafe practices in the healthcare workplace. Even though the General Duty Clause is a long-standing part of the Occupational Safety and Health Act, its proper use is frequently misunderstood. Employees' responsibilities are to follow guidelines. The employer has a responsibility to provide a workplace free of hazards, have the ability to meet and conform to OSHA standards with safe and maintained equipment, and to keep procedures communicated and updated. Safety training must be provided. All of the following elements are necessary for OSHA to prove a General Duty Clause violation. Number 1, the employer fails to keep the workplace free of hazards to which its employees were exposed. Number 2, the hazard was recognized. Number 3, the hazard was causing or was likely to cause death or serious physical harm. Number 4, there was a feasible and useful method to correct the hazard. As noted in Learning Outcome 6.2, the cycle of infection and how to break it, we will review this illustration. The first thing is infectious agents are present everywhere in the environment. Examples include bacteria, virus, fungi, and protozoa. These germs can enter the body and cause illness. Germs normally live and multiply in reservoirs such as humans, contaminated food, water, toys, and sports equipment. Do you know of any good places that viruses and bacteria can germinate? Let me know. Germs commonly leave the body through the respiratory, intestinal, and urinary tract. Open wounds allow blood and body fluids as a means of exit as well. The means of transmission which spread the germs occurs with direct physical contact, through respiratory droplets, through the fecal-oral route, including stool, and contact with blood or other bodily fluids. Transmission can also occur with needle stick injuries, ingestion of contaminated food or water, contaminated objects, or even dust particles, and through infected insects or animals. A means of entrance must be present in the host, such as through open wounds or pathways, including respiratory, intestinal, or urinary tracts. Mucous membranes of the mouth, genitourinary tract, or even the eye are other possible means of entrance. The susceptible host completes the cycle when their immune system is unable to fight the infectious agent. This population largely consists of infants, elderly, or debilitated, which means ill, humans. Infants and children have underdeveloped immune systems and may not yet be fully immunized against an infectious agent. Persons taking certain medications may have a decreased immune response or an underlying disease condition that lessens their ability to fight certain germs. Pathogens normally invade to live and multiply in reservoir hosts, such as human carriers or contaminated food, water, toys, and sports equipment. Is there anything that you see around your home that may contain this? Typhoid Mary. Typhoid Mary. Didn't know she was sick. She was in a wagon. There was a wagon train that would come by. She ran a boarding house. She would fix meals. Had no idea she had typhoid because she was asymptomatic. What happened? A lot of people died. 17, I believe, within a few miles after leaving her boarding house. It took a while for people to trace it back to her so they could put a stop to it. Yeah. And that's what happens when people are unaware that they're carriers. They don't seek medical attention and thus continue to spread the disease. So I'm going to put a link in here to Typhoid Mary so you can take a look at that. Now, endogenous infection problems result from otherwise normal substances in the body. There are many examples of exogenous infection problems, such as zoonosis, where animals have a disease which subsequently is spread to humans. Examples of zoonotic disease are anthrax, bird flu, and cat scratch fever. An example of an environmental reservoir would be water, which causes outbreaks of Legionnaire's disease. The history of Legionnaire's disease is interesting, as the outbreak occurred at a convention to celebrate America's bicentennial in Boston. The American Legion guests filled the hotel on a hot 4th of July, where air conditioning was very much appreciated but deadly, as the system was malfunctioning and spreading the germs through the air. Germs commonly leave the body through respiratory, intestinal, and urinary tracts. Open wounds allow blood and body fluids as a means of exit as well. The means of exit generally corresponds to the location of the pathogen. Bloodborne pathogens are commonplace and include insect vectors such as fleas, ticks, and mosquitoes. The means of transmission, which spreads germs, occurs with direct physical contact through respiratory droplets, through the fecal-oral route, including stool, and contact with blood or other bodily fluids. Transmission can also occur with needle stick injuries, ingestion of contaminated food or water, contaminated objects such as dust particles, and through infected insects or animals. Bacteria can grow in improperly canned foods. There are dangers involved with home canning, or foods without labels in a food pantry, or even food with labels but beyond the expiration date. A vector is a flea, fly, mosquito, tick, and they can carry organisms responsible for disease. However, not all fleas, flies, mosquitoes, and ticks are carriers. Fomites are inanimate items such as doorknobs, cell phones, and bedding. Signs seen in restaurant bathrooms instruct employees to wash their hands prior to returning to work to prevent the fecal-oral route of contamination through food. Germs can enter the body in the same opening where they exit. Many factors exist which increase or decrease the susceptibility of a human to infection. Treatment for diseases such as cancer may lower the immune system and makes the person even more susceptible to infection. The risk advantage of chemotherapy is considered because of the overlapping factors. Environmental differences impact the cycle of infection, along with political factors which may influence rural versus urban areas. Education in major areas to maintain asepsis will assist the medical assistant in breaking the cycle of infection. Each of these specific areas help eliminate a link in the chain which perpetuates the infection cycle. In 2003, the CDC launched its campaign to prevent antimicrobial resistance in healthcare settings, including 12 steps to prevent antimicrobial resistance among surgical patients, and strongly advised against a surgeon wearing nail polish. Other research exists that shows an increase in infants contracting infection in the NICU. That would be neonatal intensive care unit, where nurses had either long natural fingernails or artificial nails. Even with Learning Outcome 6.3, we are now going to summarize the blood pathogen standard and universal precautions as described in the Rules and Regulations of the Occupational Safety and Health Administration, OSHA. Various waste material will differ from office to office by specialty. However, standard and universal precautions must be followed carefully in all instances. There is a close relationship of universal precautions to standard precautions. Standard precautions are an outgrowth of the universal precautions. Various categories of tests exist for assisting with minor surgery. Mouth-to-mouth resuscitation, giving patient nose drops, and taking a blood pressure. Some tests will not require protective measures, but precautionary and protective measures to be taken into account as each procedure is prepared. The written exposure plan would be reviewed with new employees and again on an annual basis with all employees. There is a high frequency of exposure incidents, such as needle sticks. The risk exists for a medical assistant student to be exposed to such an incident at a practicum site. Review precautions and reactions for this type of incident at any point in the educational or career setting. Safety needles were designed to reduce the risk of needle stick injuries. The National Institute for Occupational Safety and Health, NIOSH, has recommendations for ways employees can avoid using needles if possible and how to participate in choosing engineered safety devices when necessary. Contact, droplet, or airborne methods of transmission are common. Some people are unconcerned, and others will go to great lengths to cover public toilet seats, avoid doorknobs, and wear masks on public transportation. Direct and indirect contact precautions should be followed for patients with stool incontinence who may transmit bacteria such as C. diff. Patients with a rash may have been scratching the areas and then spread pathogens through touching if the hands were not immediately washed. Body fluids may not be easily detectable on contaminated surfaces, so contact precautions should be taken whenever possible. Droplets from coughs and sneezes can carry up to 3 feet from the source. The technique of sneezing into the elbow area rather than covering the mouth with a hand, which would touch and contaminate surfaces, is advised. A face mask, goggles, or shield may be required. A patient needing airborne precautions should have a way to enter the medical office without contaminating the waiting room. An isolation room or separate treatment room may be set aside and ventilated for at least an hour after the patient leaves. HAIs are important because they are the most common complication of hospital care. Healthy People 2020 has a goal to prevent, reduce, and ultimately eliminate healthcare associated infections. An HAI could occur in the hospital setting, such as a UTI from a catheter, surgical site infection, bloodstream infection, or pneumonia. While an ambulatory care setting is not a hospital, the precautions should be identical.